Hi, everyone. Welcome to another episode of Motivation and That. I'm Natalie. I'm your host. And today I'm super excited because we get to touch a little bit about my more kind of professional side of life and passion with a fantastic guest who just came back from Hawaii, of all places. And I am so jealous, presenting at a regional healthcare conference there on compliance and ethics. And Ayesha Rahmanyar is joining us. She is the VP of Compliance for Equiscript. And when I was kind of doing a little bit of sourcing of, hey, who would love to join the podcast and talk about something that you're passionate about, Ayesha reached out and said, I have some ideas. And we went back and forth and really just got into this feeling. And I think it's really timely right now because policies are a weighted word like none other. But there's so many ways to think about it beyond just kind of a political, professional stance. We have stuff in our personal lives, and we are going to get into all of that today. And I think you might be a little bit surprised by some of the thoughts that Aisha and I share as we go. But I want you to know a little bit about Aisha first. So, Aisha, tell us a little bit about who you are. How the heck did you get into compliance? Why is this something you're passionate about? And we'll kind of dive in after that. But to you.
Great. Thank you, Natalie, for having me and for keeping your podcast open to suggesting topics because how else would I get people to talk about policies? Nobody likes it. um, I've worked in healthcare compliance over 10 years now. My background is actually in biology from college, and I was interested in going to pharmacy school. So I started working for a pharmacy, and I realized that no, I don't want to be a pharmacist, but I've always been interested in healthcare and helping people. Ever since I was a little girl, I remember my grandma buying me little doctor sets, and she was always talking about me becoming a doctor. But so it was ingrained in me, and I was passionate about it from a young age. But there's so many ways to make an impact in healthcare besides just the standards that we think of doctor and so on. After graduation, I started working at a pharmaceutical lab, compounding medicine, what we call personalized medicine. I did that for a couple of years, really enjoyed it, and then got into the management side of the lab. I became the lab manager, and that's where compliance came into play. The regulations and the rules and the certifications, and the more hands-on experience I had, the more I started to enjoy it and like it. And I started doing things my own way, finding different ways to follow the same rules and frameworks that we have, like HIPAA and everything. And that's the story of how I went into it. Uh, I'm not a lawyer, but I like rules. I like areas where everything is sort of black and white, and hence compliance and healthcare. From there, I went into working for healthcare IT companies. Most of my career has been working for various types of healthcare IT companies, where the end mission is always to improve healthcare, whether it's improving the quality, the access, it's all in that realm. Currently, I work with Equiscript as the VP of Compliance, and the mission is to provide access to healthcare to our rural communities that we don't think of or don't see them on the news, right? So I'm passionate about this work, and I like to go to bed at night knowing that perhaps I made someone's life a little easier by giving them access to the healthcare that maybe they wouldn't have had. So that's what drives me, and I enjoy compliance for that reason. And the backbone of a good compliance program is policies and procedures, which is why I love policies and procedures and writing them and customizing them. It's an area of compliance that most people don't enjoy, but I do. So, yeah.
And I love that. And you've hit on some keywords we're going to come back to customization, this component of a leadership piece and the backbone of things. And I think that we tend to, especially in healthcare, but also in worlds like aviation or manufacturing,
Mm-hmm.
think of policies as these very rigid things that go into place and they never really get adjusted again until we find out the policy doesn't work anymore. When in reality, a good compliance program or a good regulatory program is doing consistent reviews of policies because the environment around us is so unstable in so many
Hmm.
ways.
Correct.
They're not always going to be a steady anchor. So I know you've been in the world during COVID times, during all the kind of our shifts in moving through the ACA and everything. What have been some of your experiences with having to get people comfortable with saying, hey, this is a policy that needs to be a little fluid. We need to continually check in on it. What does that look like for you, and how have people received or not received that message?
So part of being in compliance and making sure that people receive it well is to have the ability to communicate with the various teams, and I like to say speaking their language, and going to them from the perspective of why it matters to you. Because if you go and say these are compliance policies and you have to follow them because they're my policies and I'm the compliance VP and you have to follow it, it will not work. Uh, you have to go from the perspective of saying how the policies that we have help you, uh, perhaps make your life easier. And if you have this framework, and if you, especially if you help you adjust it at least once annually, you will see actionable results. So that's how I like to approach it. And like you said, I don't want it to be policies or back in the days when we had a lot of paperwork, right? Big fat binders in bookcases just sitting there barely touched. Maybe you look at it when you get hired and that's it. But the shift now is to say no. We need to adjust those, consistently change them as, like you said, the regulations change. So one of the main things that I was part of is, work from home is such a norm now. But when I started out in compliance in the office for about 2 months, and then COVID hit. So, how to adjust our policies to now follow the same framework, especially around IT security, while you're in a completely different environment? How do we make sure we do that? So that was the approach I took, and the main important thing is to let everyone know that how to make policies into actionable items so that you can track it. And that aspect of it makes people want to, not repel. They're not repelled by it so much because I can tell you, okay, here are policies, but this is how we follow it and make it into actionable results so that I can track it not just qualitatively, but quantitatively. I can give you statistics around it. And, a lot of healthcare IT companies work with a lot of engineers and they love numbers and code. And so if you speak that language, it resonates with them. So I think this is something I learned at a young age, thanks to a professor, uh, when which was related to writing. Whenever you're writing anything, you have to keep your audience in mind. And I think being multilingual helps me with that. Uh, the ability to deliver the same message in many different ways, uh, that is the key. Because if I show you um, for example, a HIPAA policy from a hospital, the main policy, that's like a couple of hundred pages, and the only people who truly understand the language and how it's written is pretty much lawyers. So that's why there's compliance works closely with lawyers, but you need to be able to change that document, perhaps summarize it in a way that it's understandable for the general population of employees.
Yeah, and I know one of the rules that we've probably both heard over and over is sixth grade reading level is where health literacy should be. And anyone listening to this, right off the bat, nothing is at that level. So when we're translating, and I love your point about being multilingual because it's
Hmm.
true.
Right.
Not only are we translating for people of different backgrounds, different, first, language, but even for different understanding of what we're talking about, whether
Absolutely.
it's our employees or our patients, because the spectrum runs across all of that. So you brought up they shouldn't be binders sitting on the wall gathering dust, and
Mm-hmm.
historically they definitely have had that feel. But there are some nuances when it comes to policies that, we have the ones that we have to do because it is law. There's regulation stating you have to have a policy for this. And then we have things that have been very reactive over time. So something went wrong, and knee jerk reaction is we're going to write a policy so that everyone knows how to do this. And then you've got all the soft spaces, and there's things that I think, depending where you work, they're interpreted as policies. They may not be, but standard operating procedures. So how do you do that thing? What is your checklist? And I think, and I'd love to hear your thoughts on how do you not put everything into these policies that then you can enforce, and then it becomes this kind of weaponized approach.
Yeah.
But balance it out with, well, if it's not written somewhere and it's not communicated, then I can't hold you accountable if you don't do it. Like, where are some of those sweet spots and how do you find them?
So the key is to, like you said, not have one long document. You can fulfill requirements, and I like that you mentioned SOPs. So we want to break it down into three sections: policies, procedures, and then some standard operating procedures. So your policy document will be high level, things that think of it as a manual of how these are the rules we follow, and this is how we make sure we follow it. The procedure becomes how to, the steps, what do we do? And normally, when we think internally, that document becomes more important, and that document is what gets updated recently. And a lot of companies, they actually have, I'm going to use an example of Confluence pages for their procedures, where it gets updated a lot recently than the policy document does. So policy maybe once a year, because regulations in healthcare don't make drastic changes, but you can always adjust your procedures to fulfill your policy. And then I really like what you said about standard operating procedures. It made me think of what happened at work last week. I was auditing something, and these certain mistake kept popping. So I spoke to the team. I said, "What is this?" And it was actually from a client. Why does this keep happening? I know we don't have control over what our client sends, but is there perhaps something we can do? And the answer was SOP. Write a simple standard operating procedure for the staff that works with that client to have a checklist of a few things to just ensure you do in order to reduce that. And it worked. So I would approach it that way. Procedures, standard operating procedures, make it short and concise and geared to each department. I have that same policy that I mentioned, complete, like you said, in sixth grade level, because we have coordinators who, are actually, some of them are actually college interns who have it's like a simple task of gaining experience. So it's written in a language to help them just, fulfill the check boxes. And then I have the same document for leadership, and it's going to sound different. So, that is, I think, the approach. In my experience, I've seen that has made a difference.
Yeah, and I love a little bit of that because I'm thinking, when we hopped on the call and we were talking about, you have children, I don't, but, we have these unspoken policies at home
Yes.
that are very similar to work, which, like, I think we don't show up late to work, or your kiddo doesn't break their curfew. The policy is that you are supposed to be here during working hours, or you're supposed to be at home by 11 p.m. at night.
Right.
How you notify if you're not going to be there is a little bit different. That's a separate step. Maybe it varies from leader to leader or parent to parent.
Absolutely.
Or
Mm-hmm.
all of a sudden they have a cell phone they can call versus
Mm-hmm.
having to do some other type of notification. So I think that, and maybe this is just a little bit of brainstorming between you and me, new leaders often, I think, get a little heavy-handed because they're not really sure how do they work with the teams around them to fill in that space. Maybe you don't know how your other leaders are working or what
Right.
their styles are. So when you mentioned speaking to your leaders, when you've chatted with your leaders and they want to immediately say, no, every step A to Z, write it out, have it there. How do you coach them to say, that's going a little far.
Mhm.
Pull it
It's
back just a
it's
little.
in my experience, it's actually been the other way around. It's usually me telling them, no, no, this is too easy. I need you to be a little stricter. Uh, but I think it comes down to speaking to leadership in terms of the managers that each department has and how their working style and their communication style is. I think knowing how to communicate properly with the different teams is key in compliance. Compliance is also about influence. You need to be able to influence people, or no one will listen to you, right? Including leadership. And honestly, it also comes down to leadership support. The more leadership supports you and trusts you and instills that culture within the company, the more it resonates with the entire staff and they see the importance of it. Um, my approach with leadership is that, you're working with various teams, various managers with various styles. Like you said, the reporting aspect. There are managers who will say, I need you to, send a message, let me know. There are others who want you to fill out a form to let them know. Both would comply the rule or regulation that we have in place. So essentially, the policy is followed. How it's followed, there are different methods. And then for transparency, I don't know if it's because of that or because of my controlling nature, I like to have, at least for the beginning, to have eyes on it. Just let me know how you want to do it. Keep me in the loop and you can, I'm not here to tell you what not to do. I'm here to tell you how to do things your way and make sure that you're compliant with all of us as well.
And bringing that up, it makes me think a lot if folks are listening and they have a Lean Six Sigma background and they're thinking about deviation. So
Hmm.
every policy has an end goal. You're trying to get somewhere with that policy. So first off, if you're doing policy for the sake of policy, please don't. Um,
Yes.
if you are wet inking something, as we call it, to just check a box and you don't know what it's ultimately supposed to get to, it's not going to work very well. But you and I could even both say, okay, our goal is to reduce breaches, privacy breaches in the organization. And we have very different ways that we might think about it. Both policies, to your point, may work, but one may have more variation, therefore harder to hold accountability to or harder to detect than the other. And I think that early and often, and as compliance officers, we have historically been last to the table in many ways. We're the auditors, like you said. But if we're there early, we can also help say, here's where you have the largest risk of this deviating a little from where you're trying to get to. And I think sometimes that's the piece too, is just like, well, how much deviation do you want? And we come from worlds with fraud. With the HIPAA breaches. So, what are some things that you have seen where there is more acceptable variation or a higher risk in the policy of it maybe not coming out the way we like, versus ones where we're like, no, if you had to like rack and stack these, this is the stuff that we just cannot really accept any error in. Do you have some prioritization that you've kind of seen in at least your portion of the healthcare industry more consistently?
Yes, and the way it's monitored is risk-based prioritization, right? Where is the area where we are more susceptible? And across different organizations, it could be different thing. When you mentioned patient privacy, that breach, that's my number one goal, right? That is the highest risk area. So if you have technical protections in place to make sure that happens, then yes, it's very strict, rigid. There's only one way to do it, and that's to ensure that there's no gray areas and there's no little leaks in the system that could pass. So for those things, this is exactly it, and it's communicated, and it's brushed upon perhaps quarterly in company meetings, reminded, and that I've seen has helped. Or perhaps if something goes wrong, that's the best time when people learn, right? And then there are other aspects of it where, yes, I can be lenient. I think of a simple example. There are softwares in place that most companies have extra protection when they are emailing information with PHI. So it is there for a reason so that you perhaps turn it on when you are having these communications. But let's say you forgot or something happened. Well, it's not the end of the world. I won't be so strict on it because those protection that was an extra protection. There's other protections in place, so it's very unlikely that something could have happened. However, it's best practice. I don't want you to not do this, but I need you to be able to do this. So that's an example of something that, perhaps it's okay, but let's make it common practice to remember to do that. But something with the rigidness is our multi-factor authentication, for example. I no, I need that in place. And if that's broken or if it's not correctly working, then I'm sorry, I have to cut access before you're able to, because that is an area where patient privacy could be distorted. And so then for certain things like that, you're a bit more stricter. So those are the examples I can think of, and it's just, and it could be different for each company depending on how they receive their protected information and how they process it. And one thing I'd like to say as a recommendation is do good amount of due diligence on the vendors that you want to use. And just, I don't mean this in the wrong way, but oh, we use Microsoft, so it's, well, yeah, they had a breach 2 weeks ago, right? You use it, right, but you want to let them know. You have a person you're in contact with in Microsoft, and I think if you let them know that you ask for their things, they will know, okay. It just creates this trust that, okay, this is one of those companies that we need to be, they're on top of their things, so we need to let them know, make sure. Don't just assume that because they're big companies that you are automatically protected. No, those protections need to be turned on. They need to be monitored. They need to be part of your policy. Yes, it's a lot easier if you have big companies that you work with, but there are a lot of smaller companies, and there's absolutely nothing wrong with working with them, just as long as you are making sure that you are following through and checking, being diligent in their background checks.
Yeah, and I set up my LLC 2 years ago, but I've just now started to get into like Google Workspace. And the other
Mm-hmm.
day, I mean, I've had my website up for a couple of months and I don't deal with PHI right now, but I just found like the hidden section on Google Workspace where you note whether or not you're working with PHI and then you get the business associate agreement. And
Exactly.
I'm like, how come that's not an initial question like somewhere along
Right.
this way? Because I
It's
never would have known it.
exactly. And another thing is Slack. Have you heard of Slack? A lot of
Mhm.
companies use it to communicate. There are separate channels, the way they monitor it, where there are PHI enabled channels that are created within Slack. So it's not to say that channels outside of that are not protected. They are. But if you have a PHI enabled channel within that software, there's extra layers of protection for the data that's most vulnerable. And in healthcare, that's, patient data privacy. Um, so it's like you said, everything you use, you might want to dig. There's another little piece of it that we didn't know about that exists somewhere in there.
I've always joked one of the quickest ways I could find who hadn't maybe looked at those extra mitigations was if you have a SharePoint page, if you have anything like that internal to your organization, if you just do a quick search for something ambiguous, so like leadership notes, it'll be fascinating the folders that come up because there have been things called delve that have been turned on in organizations that allow you to actually look and see what other people are clicking into or what they're navigating to or access to files that are in a shared spot. And because there are so many ways to mitigate now, there's a lot of times where some of those things get missed and then all of the sudden this is how Reddit gets a hold of information that they never should have had. And it's not intentional in many ways. It's someone's curious, especially with when we're not talking PHI, but just proprietary, maybe organizational information. They want to know what's going to happen with the new organization structure, or we heard whispers of a merge. I'm going to go look and
Right.
see That's out there.
Legal documents.
Right.
Yes. Uh-huh.
And so it's a nice way to just say, "Hey, Friday afternoon, I'm gonna do a quick search or search your name out there and see what pops up." It'll really, I think, be kind of eye-opening. So when we talk PHI, when we're talking protected health information, we also have things that are third-party vendors, like you've mentioned. We've got business associates. It's not just the brick and mortar hospital that owns that medical record, and that's a I think a very important distinction. People think that's my medical record. It's actually not. It's the organization that created it owns that document. We can get into that some other time, but we don't have good ways for that information to transport between organizations right now. So there isn't one unified health record system. And you mentioned working in more rural kind of access communities. And so that's why I kind of wanted to touch on this is when you're looking at ways that we empower compliance to help access in the restricted kind of environments that we're in right now. What have been some of those things that you've done or you've seen, especially with some of our communities that maybe aren't as connected with the hubs, the mainframes, where we can still get to them quickly, do a good job at giving them care, things like that. So, where has compliance kind of come into those conversations?
So it's through, like you said, main hubs, hospitals, and having transparency with them, making sure that we have, on some level, access to their policies and their macro level of systems that they use, and then on our end. This is where the legal part of it comes in. That this is the part where you have to be very careful when you begin the relationship with rural communities, hospitals, things like that, to make sure that the way they transfer information is going to be in accordance to not just obviously the rules and regulations, laws of that state, but also in accordance with your company's standards. And I can't go further into this, but I have had both sides of this within where I work right now, where, and many other companies where I have asked as a vendor, for someone to change something before I can move forward with this relationship. And I have had something do that as a client later on in the process to do that. And so these things, they're not, they're contracts in place, they're processes in place, but they're not, hardcore. They can be adjusted. That's why we have amendments. That's why we have uh, councils working at companies. I didn't understand this before. I'm like, why do companies have lawyers? I mean, this is why. There are so many amendments and things that happen that are requested from both sides. And at the end of it, it's to protect yourself, not just from breaches, but also legally protect yourself. So if the HHS comes knocking on your door, you're prepared. You cannot say, well, it wasn't me, it was a vendor I used. That responsibility is on you. Or it wasn't because of me, it was because of my client. So I believe that process, it won't happen automatically. You need to have a vendor management program in place to at least visit it once a year. And part of a process that actually we actually mentioned this in the conference in Hawaii, where one of the VPs came up to me and said, we're starting to see this, and how do you approach this? And it was BAA reviews. We have a hospital, a small company won't have a lot. A hospital will have hundreds of BAAs, and they will not get time to revisit those and update them. But that is the key right there, is you need legal and compliance to work together to do those at least once annually. If not all, you could prioritize it, top 20, or high risk clients, and review those. And I remember talking about that at the conference, and the gentleman from a major Hawaiian hospital said, we are just starting this, and I'm noticing so many things that we are not doing that I thought are standard. And it was a second layer of encryption on one of them. How did security IT teams didn't notice that, okay, we have encryption in place, but you need a specific kind for this very important client that you work with. or they will not renew this BAA. So for compliance, that makes me happy. It's not good news for the technology side, but I'm like, okay, good. So now you have another person telling you you have to make this change or it won't get signed. So I was joking with them. I said, then you can say, well, last year when I told you to do it, it was like, okay, we have to prioritize it, but it never happened. But now you have the client directly asking you to make this technical change in your process or this BAA won't be renewed. So it all ties into compliance, and I think the way to not miss them is what HHS has put forward as the 7 elements of compliance, and I can't stress the importance of that. If companies follow that, even if it's once a year, there is a reason why that was put in place as the recommendation, and it hasn't changed in years because it works. Um, so auditing and monitoring is one aspect of that, and that is how this gap was found by this big hospital that ended up doing a whole review now. So,
Well, and HHS even has, I think it's in the last year or two, they've come out with, if you're a small organization, we know you may not be able to do every single one of these
right.
elements to this point.
Mm-hmm.
Here's the five we recommend maybe you shift a little with, or you check back in and grow. And the same goes for extremely large organizations. They've actually looked at the other side and said, if you're super big, you're at higher risk for a lot of this. Here's what you need to look at. And I think that's wonderfully responsive by HHS to acknowledge that, because you have so many small startup healthcare entities now that are, for people, or they're consulting firms, but
Right.
nonetheless, they're still engaged and working in this industry in a way that we've often been like, well, figure out how to do 50 million things with the three people that you
Yeah.
have here.
And that's why I love frameworks.
Hmm.
I don't work for the government, but I love some of the frameworks that they have put forward because it gives it a backbone, and just the knowing that it comes from HHS and it's being used by CMS and all these organizations, it gives it a good backbone. And like you said, there are organizations that will have 5 individuals dedicated to just one aspect of that, which is policy. And then they will have organizations smaller where they'll have one or two to tackle all aspects of that. But I think having a backbone and a structure really helps. And another thing is also to engage with Healthcare Compliance Association. They produce a lot of documents, they produce a lot of guidance, they give a lot of updates. So all this is an easy way to make sure you're on top of changing regulations or updated frameworks. I mean, they produce a report every year, if not every 6 months, and it's a fun read for me. I like to look through it, but I think that's a good approach to take, whether you're a small company or a large company.
I think one of the other shifts that recently I've seen, and it probably does not make our clinical partners as thrilled, is this idea that clinical quality and patient safety are now being looked at by Health and Human Services as a part of compliance. And I
Mm-hmm.
think it's scary wording, but it really is a dual partnership. So I think to your kind of lab and pharmacy component, I, as a non-clinician, would never expect to be able to go in and speak to every pharmaceutical compliance piece, especially if it's patient safety related. I want that partner to tell me, no, this is super outdated. Like, there's a
Yes,
reason why
exactly.
we struggle with this. And, I think to some policies we will never see go away. Hand hygiene. It is a patient safety policy
Yes.
that's never going anywhere. It's evidence-based, it's gonna be staying, and yet it's one of those murky areas where a compliance officer can stand and watch and see, has everyone washed their
Mhm.
hands as they've left that area, and determine maybe we need to do a refresher education. So it can be, and I think this is where I want to get to on the ownership of policy and the oversight of policy, that just because something is clinical or non-clinical, you can still work together to determine the compliance with those policies and to do those double checks. So anything that you've seen from kind of your world, the farm, the lab, those type of things where that partnership has really just been able to move that a step forward and make it that much cleaner and better.
Absolutely. So I mentioned my background is in biology, so I understand some of these a little better scientifically, and I have worked in pharmacies and labs. So I would partner with clinical members of our team, where we check and basically get their take on it, and then also they actually know more about the updated standard, perhaps, or the change or the shift, depending on the type of organization you work for. I met someone in Hawaii who worked in compliance for research medication company that was doing research on medicine and the efficacy of that. That was, and they said this is an area of research compliance. That was very awesome to talk to her about it. And so they team with the clinical partners to say what is still up to date. Like you said, from something simple to washing hygiene to something more complex into which test tubes or which reagents are okay and which are not based on studies or new guidelines from our government, FDA, CDC, anything like that. And so there's no way you would know all of that. So you need to partner with them. And I think what has helped me the most is to provide that framework. And even if individuals don't look at it or read it, just that they see it's there, it makes a world of a difference. And so going back to policies, I've added a reference section at the end of all our policies referencing why and where this came from. You know, why is it applicable to us? Well, it's applicable to us, pretty much all healthcare companies, because of HIPAA privacy law, HIPAA security law. So that's almost a given. And then perhaps your company has certifications. For example, you're HITRA certified, so it fulfills this requirement, and I would actually put the numbers in there. And then similarly for clinical documents, you get that information from your clinical staff. You have, and for most past couple of years, the people that I've worked with have been pharmacists, so they are more up to date on it. Because how are they more up to date on it? Well, they have a license. They have to renew. In order to renew that, they need certain things. So it all kind of falls into place, which is why I say that you can't go wrong if you follow the frameworks. And knowing who would have the most up-to-date information depending on which asset. There are another thing is if you work in healthcare IT, a lot of IT is healthcare, a lot of it is software, a lot of it is engineer code. That is not my area, right? I've learned a lot from it, working with all these folks, but there are rules and regulations and frameworks around writing code and how that's done. I don't know, but speaking to these people, I can embed those into the policy. And when it's time for me to check it, renew it, I can revisit it. Perhaps I might not need them this time and say, okay, is there an updated version of what they gave us? Not, let me go speak to them again. So it's not like police where you know all the rules that you need to enforce. It's like I have to enforce, make sure things happen of rules and regulations I might not even heard of, but I will learn based on the organization that I'm part of.
And I love those examples because to your point, even police officers, you have specialized divisions, right? You've got your
Yeah,
forensics, you've
absolutely.
got your
There's a reason why.
right,
Yes.
right. And compliance is no different. I mean, I like to think sometimes we're more coaches and counselors than we are anything else. Our power sits in the playbooks that we hold. And so we may know who to go and talk to and who to connect with. And does this kind of fit what these standard expectations might be? But there's a huge deferral to expertise that comes with good compliance officers. So compliance people that are listening to this, I encourage you to, if you have not met with all of your like clinical leads, find a way to sit down and have lunch with them at some point. And, find a way to make sure that they know we're not there to threaten anything. We are there to make their lives easier as much as they may not believe
Yes,
that in the end.
absolutely. And that's a great point you brought because I have actually been in conversations with executive leaders who have been seriously offended at what I've had to say. And it's like you're forgetting our paycheck comes from the same company, or we essentially have the same goal. Your goal is to bring money. My goal is to make sure that money stays and we don't get fines and that money goes away. Right? So, and that's where the leadership backup comes into play. I can't stress it enough how important it is. And if you're a compliance individual working with, and many of us have, with leadership where you don't have full support, it's very difficult. Your job is 10 times harder. So you're lucky if you work for a company where you have that openness, which is why, once again, HHS recommends that compliance does not report to the legal team, and they report directly to the board and CEO. This is why they do this. And companies that are able to follow it have a much better compliance program in place. But yes, absolutely. Speak to the managers, the VPs of all the companies, and actually start out saying, what keeps you up at night? What is an area of risk that you're afraid that your employees might, what do you think your employees could break? I can help you make sure that doesn't happen. Well, how can you help me? I don't know, maybe I can write an SOP and have everyone have it there while they're working on it. And then the more you do it, then it becomes second nature. So yes, the goal is to make sure everyone knows that you are there to help, support. You are fighting for the same goal. Yes.
And it's great in strategic conversations too, right? Because
Hmm.
if we're looking and we say, okay, we have a 3-year plan to implement this or do this thing, and then to be able to say, okay, well, again, if I'm there at the beginning, I can actually make sure this moves
Yes.
fast as possible because we'll know what hurdles we might have to overcome or what waivers we might need or this versus you have this beautiful plan and it looks great but someone at the very beginning missed one thing that was necessary and now we're the people coming in at
Telling
our
you to change it, which I'm sure everyone loves to hear, right? Everyone loves to hear from people who are supposedly don't know how to do their job, telling them that I need you to do it this way. But yes, I think what I've noticed is, which is why, it's funny. I was talking to my family members and I told them that I have another podcast interview and I'm starting to enjoy doing these. And they said, years ago, if you had asked me, I'm thinking high school, college, that I'd be presenting, I would have said you are crazy. I will never do this. I despised my communication class because I had to go up and present and I hated it. And I think that shift happened in my life when I was in college and I took a job. It was a teaching job to teach a pharmacy technician program. And I noticed how much I like teaching. And so a lot of times I have to stop myself from doing that, but I tend to do that. But I've seen actually good responses from people that I work with, that you have to have a sense of like informing and teaching, motivating. I love motivating people, and it makes a huge difference. To the point where now, there were projects that I have not known about where I've been invited to the meetings just to say, hey, we just want to run this by you from top to finish and let us know if there's anything you see, any compliance issues. I can't tell you how much I appreciate that because they understand that in order for this project to move, there are so many variables, and not to mention cost. For this to go back and have to change, it's huge. And so leaders that understand that will bring compliance to the table and say, you have another third person hearing this. And I don't need to know the technical details of it. I just need to know enough and know to ask the right questions. And I think one of those was I was looking into it and I saw a name and I said, why do I see a name there? you know, and they said, "Oh, no, no, it's okay. This is not the published version. It's the version only I can see." And I said, "Okay, phew." But things like this that perhaps could have been missed. Um, and so that is one of the reasons I love this field because it's a little bit of everything. And if you have a passion for healthcare, the world is shifting to IT and AI. You need to like technology. If you do not like technology, working in healthcare is going to be very difficult, even as a clinician. I remember when I was working as a lab manager when my compliance journey started, I had a mentor who was an elderly person who had been working in labs all her life, brilliant at what she did. And so she would get mad at me sometimes and say, it doesn't matter what I do. It's just all that matters to you is what's on paper. And I said, no, of course it matters to me what you do. But that's from that generation where documentation didn't exist. I know you're doing this correctly. I just need you to document it, right? And so that's the best part of compliance, I think, is it's constantly evolving, and it allows you to explore words. I mean, if it wasn't for compliance, I would have not known that I need to further educate myself in cybersecurity, which is why I'm doing a certification on it. And it will only help my career because it will help me better understand data, healthcare data. It's all in technology. There is no paper anymore. I get so annoyed when I go to a doctor's office and they give me papers to fill out. I say, where are you storing this? I'd rather be in the cloud. I don't want to be in a paper somewhere. But that's why you need to meet with all your leaders and have these conversations with them.
Yeah, and bringing up AI is a great kind of transition into the final kind of chunk topic, which was this idea of cookie cutters and, what industry and what are those different things. And, there's, I joke that cookie cutters should stay in the kitchen most times.
Absolutely.
You cannot take a policy out of a manufacturing widget-based organization and pop it into a healthcare organization because people are not widgets and it just doesn't work that way. And we're in a world where AI, I pop into ChatGPT, write me a policy for X, Y, and Z, and it cranks something out. And I'm like, great. Yet I don't, because we've not mastered what those prompts should be or how we do that. What are some of the things that are really critical for people to consider as they're sharing best practices across industry, even across different types of healthcare organizations, that it's not copy paste, that we're not taking something and just going, this looks great, I'm going to put it in here. So, what are some of those trigger pieces or those questions that we should be asking as we look at borrowing and then implementing?
So I really like that the funny mention of cookie cutter. Absolutely. There is no true one size fits all in compliance, right? Every organization has unique risks, cultures, workflows, all of these that are different. And even companies where you think of, oh, a similar company, this let's say a PBM. There's so many different kinds of PBMs. They're all doing the same thing, yes, but they're very, very different, right? Essentially, they're following the general rules, but no, which is why customization is so important, right? I'll give you an example. I worked at a company once, and I went in there to get a certification for them, and they said, you know what? The auditor we paid 10 grand, I believe. They gave us a bunch of policies. I think you're good on policies. I could not use a single page of the 10 grand documents that came from experts that had used it for another company that was very similar. I can't. It was either too much. And I said, you didn't ask a simple question. Reading through these, do you do this stuff? Or forget to do this stuff. Does it even apply to you? There's 5 pages in here written about, patient entry. You don't do that. So why is it applicable to you? And you paid so much money for it. So I always joke with them. I'm like, you know what? I need to charge you besides this for that 10 grand. But it's not the other company's fault. They have seen organizations adapt it. So yes, that would work if you just want to have a policy for the sake of having a policy and showing a regulator that you have a policy. But as soon as someone opens it and reads and asks one or two questions, you will start seeing employees panic because they haven't read it. It's not embedded. It's definitely not part of their culture. So the key is to have a balance. I'm not saying not to use those. You need to have a backbone. You need to start somewhere. And AI, ChatGPT, there is no issue with that. But use it as a framework. You can, if you work for a company that does claim processing for just one type of claim in hospitals, let's say claim processing for blood tests, that's it. Tell ChatGPT you want policies for that. Use it as a backbone, but customize it. Make it fit what you do. Move things, add things, and I joke with my team members. I tell them that sometimes they give me things, and I ask them, "Can you write me the procedure? How do we do this? I want to know how we do it because I need to embed it somewhere." And then they send me this list, and I say, "Okay, I can't look at this. I need to make it pretty." Is what I what I joke about. I don't want to get into the gender thing, but like the girl's touch maybe, and so it makes it readable. It makes it presentable. I can give you the same document in two different ways with two different colors and fonts, and you will have a different approach subconsciously for how you want to read it or not. And so I think you have to have a structure, kind of like perhaps your company's simple things, your logo, your color scheme, this and that, and make it look like if they open the document, they know it belongs to your company because it follows similar pattern. That's important. But to me, it is. I know a lot of people don't care about that. And then, so that makes the content more visible. So yes, use AI as a backbone, but don't just slap it in there because it will not make sense. It's high level. And the goal is to use it. I like to say, use it as like a calculator. Use it to help you, but you cannot use it to just have it in there. So I think that's how you turn compliance from paperwork to practice, actionable. But if you just use that and slap it, then yes. And maybe you're starting out and you just want that. And that's okay in the beginning. But as your company progresses and you know how and why and when you want to do things, then you can go back and revisit and customize it to your company for sure.
Yeah, and when we wrap up in a few minutes, I know we're going to give about 5 questions to stress test anything with, and one of them is my favorite, which is usability or reasonableness, really. And I,
Absolutely.
I think
Hmm.
one way that we could see that is when COVID happened and we put all these COVID policies into place. Question becomes, if you back up a little bit and you go, well, okay, do we just need something that deals with highly infectious processes or crisis management framework,
Hmm.
like that? And it takes me back to your thought process on framework. Odds are there's a framework for this somewhere.
It's
Maybe,
called business continuity.
right?
Yes.
And
Yes.
so it's that knee jerk reaction we see in places that may go, okay, well, now we need a policy for all this stuff. And it's like, no, we need to reinforce the policies we already had around our COOP plans, around our business continuity. And I think that's also a great place that if a compliance officer is going, I don't know what to do if there's ever another pandemic, because, right, everyone's just like, make sure everyone
I
can,
never thought we would hit a pandemic, right?
right, is to look at what you already have and go, we can use this in this instance. Let's not make something new. Let's not do something that now contradicts 10 other things that we have in place. But take this thing and maybe, to your point earlier, make an amendment, make a little addition.
I absolutely. I met someone at another conference, and they said that when COVID hit, they were tasked by the legal department to tell their IT department, I need you to write out a different procedure so that now that you're working from home and these ABC aspects of the job that you generally did from the office, now you have to do from home. So we need to shift it around. And so they panicked and, they were worried. And so they did this document from scratch and made it work. Okay, after it was done, they found out they actually had a business continuity in place for maybe not COVID, but another possible health crisis. They maybe not, it's maybe not called a pandemic in the policy, but it says, health crisis, environmental factor, and you could have just used that and built upon it if you hadn't panicked. And that also brings you back to you haven't visited it, so you didn't even know it exists. You actually had it, but yeah.
Yeah. And so, a couple things kind of as we get into this final quick checklist is, if you're not a compliance person, it still doesn't mean you can't ask questions. When you mentioned earlier, the moment someone starts asking questions about a policy, it may be telling us we've got a Swiss cheese policy. There's a few too many holes in here. And so, if you're reading something and it doesn't make sense, I would encourage everyone out there. I know it can be scary, especially maybe if your boss was part of writing it, to ask some curious questions. Okay, well, what does this mean? And don't make assumptions because to one of the things you said earlier, ignorance is not bliss when it comes to compliance. It will never get you off the hook to be like, I just didn't know, or I assumed. They'll be like, well, that's not really acceptable.
It isn't.
So, ask those questions, or this is the beauty of the compliance officer should be very objective and outside kind of the main scope is just ask them. I mean, in a lot of ways, we can protect confidentiality. We'll go over to, some leaders and say, we're getting a lot of questions about, what this actually means. Can we
Absolutely.
talk about it at our next
Hmm.
committee meeting? So again, tap into those pieces. But now that we've got people probably thinking about all of the policies in their personal life and their professional life, what are some of the stress test questions that you would recommend kind of approaching that to say, okay, do we need this? Does it need to be looked at? Does it need a revision? Is it right for us? What are some of those questions that you'd prompt people to look at?
So that's a great question. I almost every company that I've worked with, if they've not had it, I've asked them to put a list together of all the policies from all the departments, and I want to look at the whole thing. And like you said, there are places I work with where I found five policies that was maybe all two paragraphs, part of just one big policy. So yes, your team members are scared and they're like, "Oh my God, we have so many policies." Well, that's because of this error. And I've had the other version of it as well, right? Where I've had one extremely long policy, where it needs to be broken down to a short policy and two procedures, perhaps. So I would go off of speaking to the departments that are using the policy or are supposed to use the policy or the people who own it to say, okay, I see five policies here on your endpoint protection. Isn't that one? And I can just help you combine it into various sections, for example. So that's I think a key area. There are parts, and I know for most healthcare IT companies, your information security policy will be the longest, which is why you will have procedure documents that will follow. So that's what I would do is honestly put together a list and then depending on who the owners are, go to them with all of that and say, okay, let's have a talk about it. Here's what I think is imperative. You tell me what your thought process is, and then let's work on consolidating those. Because a company that is I'm gonna I'm gonna throw some numbers. A company which is from a 50 to 200 employees, I don't think if you have more than 20 policies, I think there's something broken. And if you have less than 15, there's also something broken. So you kind of want to do it that way. Uh,
Yeah. So I think that's great, and I think that as you look at that, and I know I'm going to go back to a couple of folks that I work with that I know have far more policies than they probably need to have.
right.
And
Hmm.
coach, this is really a process. This is an SOP. The policy is just that we're going to do X, Y, and Z, and then how we do
Right.
that will be over
Is a
here.
separate thing. Yes,
Right.
exactly.
Uh, and to look at then, if you're looking at those things, the purpose of them, who are they meant for? Because to your point, if I have five policies on hand hygiene, at five different hospitals and one, corporate organization, it's one. It's one policy on hand hygiene because it's all for the same audience. Your legal reg fit, your ability to be actually be done, and then if you're not measuring that policy does not exist in the world of anyone's eyes because you have no idea if it works or not. So if you're looking at something, you're like, well, we can't get rid of this. Then the next question is, well, can you even measure what the outcome of it is? And that can be really tricky, but that's where your partnerships come in, your compliance, your analysis group, your clinical folks that actually know what the consequences look like. So I hope that people, and this is probably a far more technical pod episode than I usually do, but everyone listening has been impacted by policy. They have been impacted in their organizations. And unless you're at a McDonald's, which looks exactly the same, here to here to here, and the process is the same, you are used to variation. So this hopefully will empower folks to utilize their tools a little bit more, utilize their knowledge, think about things in a different way, which is there's a power in policy that doesn't have to be a negative power, but is actually a let's right, let's make sure we're successful, and we can do that by empowering these
Yeah,
policies.
and to use your example and give you perhaps more proof to our audience of why this matters, to go back to the hand washing thing, the policy would be prevent infection.
Mhm.
That is not going anywhere. The policy is always to prevent infection. And then one of those procedures is hand washing. So the hand washing technique, place, SOP, the perhaps the soap, whatever will change. That policy of preventing infection will not change. It's very unlikely. So that's how you want to view it, right? And that's how you want to break down your documents. And lastly, we have a lot of organizations that gather extra certifications, or follow other frameworks. If you look into it, a lot of the gist of it says, it doesn't say follow me, it says follow yours. Do you follow yours? Show me your policy and then show me that you follow it. So it's not saying, here is mine, I need to get the certification. I need you to do this and I need you to show me how it's no, a lot of times it's like, let me see your policy and help you fix it and then show me that you do yours. It doesn't say do mine. And that's why it says that, because it's customization. Um,
Love this conversation.
yeah,
I
I did.
love
I
the
enjoyed
fact
it too. Thank you.
that I think we've brought it down to hopefully a level that's maybe not sixth grade reading level, but hey, we're in that high school, junior high realm.
Yes.
And
Well, my 1 year old, my 4 year old surprises me. I definitely did not have half of his knowledge as a 4 year old. So
right. Well, any last kind of messages as we close up today and we send folks back out into their day, their work day, their
Mhm.
weekend, whatever it might look like? Anything else you'd like to share?
Just notice, compliance is for everyone. It's everyone's responsibility. You have you could have a VP or a compliance officer monitoring and watching, but they need your help. They need your help to help you. And lastly, I always like to close with this. If you're in a meeting and all the leaders are talking about, numbers, or perhaps clinical team is talking about how they've kept patient satisfaction high, infection low. Finance is talking about, the profit they've brought to the company, and then compliance's answer is always, "What did you save?" The company, the entire company. I saved all of you. So I'm not the the bring money department, but it's the prevent fine department and prevent company closing department. So
Prevention is a tough one, but the prevention is good
yes.
policy. So
Yes,
it all comes
exactly.
back full
It all
circle.
comes back to that. Yes. Please enjoy writing your policies. Give policies a chance. There's some fun in it. You can find it.
And if you're interested in talking to Ayesha more, I'm going to make sure that I link her LinkedIn on the
Please do.
podcast description so you'll be able to get in touch with her. And again, we're not boring in compliance. We actually are pretty kind of into this if you
I
haven't
was
figured it out.
it was so exciting to be in Hawaii with a group of people where I didn't have to question if they're interested, and I'm like, oh my God, it feels so good to be in a room with compliance nerds.
Love
So
it. So thank you for joining, and hopefully this will be a great starter conversation for other folks, and can't wait to talk more in the near future.
Absolutely. It was great talking to you. Thank you for having me.